how they actually contribute to how health services can be shaped. So the role of the consumer rep is to build on what we have learned ourselves and be able to take as strategic and diverse eye to that as we can to make sure that it suits our patients generally.
It's the ability to look at the big picture and not just become stuck in what's happening with you, because we need to look at the whole umbrella and look at healthcare as a whole and not just a specialty, because the role of the consumer leader is to actually help everybody have a say and not just get bogged down in certain subjects, so that it's a very broad spectrum umbrella. But I think it's really important that we look at the big picture and not just concentrate on one part of it. I think you need to have communication skills because you're dealing with healthcare professionals. And I remember being a speaker at a medical conference a few years back. And after I'd spoken, a doctor approached me and said that when she saw that a patient was speaking, she thought, oh no, not another whinging patient. And unfortunately, that is a fairly common way that consumers are looked at still in the medical profession. So that in order to be able to stand up and speak, you need confidence in what you're saying, and you need the ability to communicate it in an effective way so that they actually listen.
It's somewhat on me to learn what system am I entering, what works in it, what works well, what works badly. So you always remember that you have 2 ears and 1 mouth and 1 brain. They all have to be switched on, and you have to use them in that sort of quantity.
I think self-reflection is probably one of those key attributes. When you are in this role, there are so many different things. You are often suddenly called upon to give the opinion of many people who aren't in the room. So it's how do you best reflect that you may be able to understand that, or, you know, provide important feedback to the system about how they need to gather that themselves. I think also there are going to be many times when you are sitting in the room and you are not welcome. And it's not always the safest place to be. So it's important to reflect on you're here for a bigger picture, and that you need to have somebody else that you can debrief with afterwards. But I think that core thing of self-reflection, at all times you need to ask yourself, am I here to tick a box, or am I really creating a difference? Is this busy work, or is this something that's moving the needle forward?